Now, Labour is leading new calls for NHS reform as new figures show that thousands are waiting over 9 minutes for their 999 call to be answered.
Well, let's talk to the Shadow Minister for Public Health, Andrew Gwynne, who joins us now. Mr Gwynne, very good morning to you. Nice to see you. So what does Labour want to do? What are the key measures that you think could change all of this?
So, look, what we are witnessing is a real knock-on effect because of delays in emergency care, from increased pressures on call handlers right the way through to ambulance crews. And this is a consequence of 13 years of Tory mismanagement and neglect of our NHS. We need to basically fix the entire system, and the challenge is going to be huge. So primary care is an issue. We've got to reform primary care so that people don't get frustrated that they can't see a GP and go to A&E when they don't need to go to A&E. So that's part of the solution, to reform primary care. It's also about fixing the pathway through hospital and, more importantly, the gateway out of hospital through social care reforms. And when you start to do that, you unpick some of the problems. The biggest problem is that our staff are doing brilliant work in the NHS, but there are massive recruitment and retention issues. The staff that are in the NHS are under enormous pressure. They're doing more with less, and they're working longer hours. So what we would propose is the largest workforce expansion in the NHS's history, recruiting those doctors, those nurses, those care workers and those midwives for the future. And that's the only way we're going to resolve some of these key issues, and it's going to take reform.
But, Mr Gwynne, you will know as well as I do that it doesn't matter how many of the 10,000 new nurses that you want going through the system. It's going to take them 3 years to be trained. So this is not a short-term fix. You're not going to be able to do anything to change the NHS just by bringing in more nurses for at least another 3 years when they come out of their training.
It's not a quick fix, but the problem that we've seen over too long, to be fair, is that we approach the NHS each winter, there's a problem, we get a sticking plaster, we fix it. But what we don't fix are the long-term problems that are in the NHS. And we know what those problems are, and we know what the solutions are. So yes, you have to have short-term strategies, like the government's announced, for the immediate problems. But we've also got to address the long-term, and we can't do that without reform. With the investment has to come the reform. Otherwise, the NHS just swallows up ever more resource. We can do this, Angela. You know, it's easy to just think this system is too big, the problems are too great, you can't fix it. But the point is, we did fix it. The NHS was on its knees in 1997. I'd argue it's worse today than it was then, but there were huge problems in the NHS in 1997. Yet by 2010, we gave to the incoming Conservative-led coalition a golden inheritance of the lowest waiting times, the lowest waiting lists, the highest patient satisfaction, and the NHS was independently judged by the Commonwealth Fund as one of the best healthcare systems in the world. It was ranked at number 2. That is something we achieved in the past through reform, through investment, and it's something that will fall to the next Labour government to do the same, to save and rebuild our NHS.
Talking about looking to the future, what do you make of what the Chancellor's going to say today? I mean, it's all over the papers. All the details are out. You know, burning EU red tape to unlock investment of up to £100 billion to grow the economy. I mean, these are the sort of messages we need, aren't they?
Well, they're the messages we need, but, Stephen, they're the messages we've had for the last 13 years. If I had £1 for every time the government have said we need to cut red tape, we need to invest in regions, we need to level up, we need to grow the economy, we need more growth, we need better productivity, I'd be able to pay the tax bill of Nadeem Zahawi. You know, I don't want words, I want action. And quite frankly, I've been sick and tired of hearing the same messages over 13 years. This government can't deliver on the economy and it can't deliver on public services. The problem is the government, and we need a new one.
You brought up the name Nadeem Zahawi. What do you make of the current situation? Should he stay? Should he go? Should he be sacked? Should he resign?
Look, I think, Angela, his position is completely untenable. To most people in the real world, you know, we're gutted if we fill in our self-assessment form and we get that letter back from the HMRC and they say we owe them 50 quid and we pay the 50 quid. It is incomprehensible that you could have to owe the HMRC a seven-figure sum, many millions of pounds. And in what world do you try not to pay it? You know, it's not just one rule for them, it's another world for them. And that's why I think, you know, somebody who holds one of the senior positions in Cabinet as Tory Party chair, who's held one of the highest offices of state as Chancellor of the Exchequer, responsible for tax policy, responsible for people paying their money on time to the government, I think his position is untenable, and quite frankly, he shouldn't have hung on for as long as he has so far. He should just do the right thing and go.
We're very nearly out of time. Can I just quickly ask you about HS2? Because this actually is not a party political issue, because it's going, if you win the next election, it's going to fall under your remit, isn't it? The government refusing now to confirm that HS2 is going to carry on to its London terminal. And even if it does, it might be 2038. Now, what do we do about all of this? Would Labour want to scrap the system or what? What happens?
Well, look, this is a huge infrastructure project. It's one that is going to cost an awful lot of money. And if you've made the decision to build it, and you've started to spend many billions of pounds building it, and you get it to Birmingham, and you get it to Manchester, I quite frankly think you should finish the job and take it all the way to London. Because if you don't do that, what does that actually say about the communities that were supposed to benefit from HS2? What it says is you can now get a fast train to the edge of London. Well, where's the benefit of that? You know, if you're going to build it and you're going to spend this huge amount of money, do it properly and go all the way to the capital.